have to do that anymore. So we have favored nations. So that's what we have. And it's one of the biggest days I think anybody will ever have. We're talking about massive numbers, and the numbers are going to get even better with a little time. And I will say, Albert, I think that the drug companies are going to be the same. You're going to, the world, we're really competing against the world, so they have more people. So we'll come down a lot, and the world's going to go up a little bit. And the end result is you're going to, I think, do the same business pretty much. Maybe you'll figure a way to do more business, I think, knowing you. But I think the drug companies, we're going to come down a lot, the U.S. The U.S. will come down a lot. But the world, many more people, is going to go up a little bit, and it equalized, and it's a great tribute. And I want to thank everybody up here. J.D., thank you for all of your help, too, and Howard, great, really great job. Thank you all very much. Do you have any questions? How about we focus on this? It's so big, let's focus on this.
Mr. President, can you please give us a timeline?
Yeah, Mr. President, first of all, this kind of goes along with your America First campaign promises, right, lowering health care costs. On a day that it seems like we're going into a government shutdown led by Democrats on the premise of providing health benefits to illegals, this seems to, your move here is a stark contrast to that. Could the same principles that you did today apply to health insurance, to maybe lower the cost of health insurance? Many Americans are kind of struggling with that.
We're working on just that, little different group, but we're working on just that. It could, I don't know to this extent. We have a pill, one pill in particular we're going to show you next week. It sells for $10 in other countries and $137 in the U.S. And that's coming down now to probably $15 or $18. They'll go up to 18. I think that's pretty much right, Albert. It's not you, but they'll go up to 18, and we'll come down from 135 or whatever down to 18. I mean, that's a massive number. Remember, I was the one that held a news conference because I lowered drug prices by 1/4%. I think it was 1/8 of 1%, but it was the only one in 28 years that brought drug prices down for the year. But it was a very small number. Now we're talking about, you're going to see one over 1,000%. Look at these numbers. So, and this has a big impact, even on the discussion that we'll have with Chuck Schumer, who was here yesterday, along with a very nice gentleman who I didn't really know. You know who I'm talking about. The two of them came, and we had a good discussion, and we're going to see what happens. We're going to see what happens. But this has a huge impact on that because these numbers are going to bring Medicaid. We talk about Obamacare. Obamacare is a failure. Obamacare is not good. It's not. It's there, but relative to other health care programs, it's in the lower 20%. It's not good. And I asked the Democrat representatives, what do you think about coming up with a better health care? This actually allows you to do that because the cost of prescription medicine is a big, I guess, a very big, more than 50% the cost of what we're talking about. So we might be able to do something like that. This is one of the biggest news conferences from a medical standpoint that I think has ever been had by any administration. Yeah, please.
I'm curious, where are the other companies other than Pfizer? Are you expecting them to come on later?
They're all with us. And I was honored to have Albert be the first. He's done a fantastic job with, as you know, with the COVID.